monitoring guidance question and answer session that we had scheduled. We do have that rescheduled. The email blast has not went out yet. It's scheduled, I believe, to go out Tuesday. However, it is already on the division website, on the division website on our upcoming webinar page. So if you'll go there, you will see that September 15th at 9 a.m. There are also several webinars.
Heike, we can't hear you.
I will stop sharing my screen for a moment, and I will turn it over to Dr. Stanislaus.
Good morning. For those who do not know me, my name is Angeline Stanislaus. I'm the Chief Medical Director for the Department of Mental Health. And I want to use this forum as a way to share information from the department. So one of the things that has, the two things I want to talk about. One is on the third dose or the booster dose for individuals vaccination, third dose vaccination of the vaccine for those with immunocompromised conditions. And the other one I want to talk about is the monoclonal antibodies. So let me talk about the third dose for immunocompromised individuals. So the FDA or the and CDC have both recommended that individuals, especially those who have immunosuppressive conditions, what does that mean? Somebody who's having autoimmune diseases and are taking medications that suppress their immunity, or their doctor has told them that their body does not produce the healthy immune response, or they're taking a whole, they're prescribed to take medications that change the immunity in the body, such as there are so many other medications such as steroids, high-dose steroids, Humira, treatment for cancer, etc. Those individuals can get their third dose. Recommend that they get their third dose of the mRNA vaccine, and that is the Pfizer vaccine or the Moderna vaccine. They haven't said anything yet about the J&J vaccine, so those who have received the J&J vaccine probably should wait a little bit or talk to their doctors to really see what would be the best way to go about it. But if an individual with immunocompromised conditions or on immune suppressing medications, and if they want to talk to their doctor, or they can just go to any of the pharmacy or places where they're vaccinating and tell them that they're there for their third dose and they should be able to get that. Most of the time, they just need to sign a self-attestation form saying that they do suffer from a medical condition that qualifies them under the immunocompromised. But they don't need a doctor's certificate, they don't need a doctor's letter, they don't need any other confirmation. All they need is to sign the self-attestation form, and they should be able to get the third dose. For those who have got the Pfizer vaccine, it is preferable that they get the third dose of Pfizer. For those who have got the Moderna vaccine, they get the third dose of Moderna. The only caveat is it has to be at least 28 days between the second dose and the third dose. So if you had got your second dose of the vaccine, then you have to wait at 28 days before 28 days before you get your third dose. If you have any trouble getting your third dose in the community, and this is for not just you, but the people you serve in the community providers, if you have difficulty getting the third dose for your clients or individuals you care for and who qualify under the immunocompromised guideline, then please let us know and we'll see what we can help you with. The next one I want to talk to you about is monoclonal antibodies. So there's a question here. Let me just quickly answer this question. Yes. Was there a question about people with monoclonal antibodies? People with the vaccine, if they got Pfizer, can they get there's one question. Does anyone taking monitor class need to get the booster? I would recommend that you talk to your primary care physician regarding individual medications that you're taking that qualify for a booster, because it's going to be pretty exhaustive, and it is best that your primary doctor answers that question for you. Another question is, if people received a Moderna vaccine, can they get Pfizer booster or vice versa? Can people mix up? Ideally, no. Ideally, the CDC recommends that if you get Pfizer, get another dose of Pfizer, and if you get Moderna, you get another dose of Moderna. But in case there is not one available, or there is undue delay, or for any reason you're not able to get the third dose of the same vaccine that you got before, then talk to your doctor and see if you can mix. There is some data that says that you can mix it, but it is best that you get the same as the second dose. So if you got Pfizer, get the third dose in Pfizer. If you got Moderna, get the third dose in Moderna. All right, not seeing any more questions on the vaccine. I'm going to talk briefly about the monoclonal antibodies. So today, the Department of Health and Senior Services published their monoclonal antibody treatment. So what is monoclonal antibody? I think I've talked about this earlier. So once you get COVID infection in your body, or the virus, either you are immunocompromised, you're unvaccinated, and you have exposed yourself to the virus. Let's say that you were with someone, you were unvaccinated, you were with someone that was unmasked, and they were talking to you very close, standing very close to that individual, and you knew that you had very strong exposure of the virus, and that other individual tested positive, and so you had very high exposure to the virus, and you fall under the high risk category. Heika, if you can move it down a little bit on this, on the screen, it tells you all the high risk. Can you go? Yeah. So yes, stop there. So the way they define high risk is that you have exposure to COVID, or you have COVID, you're diagnosed with COVID, plus you have a high risk situation such as obesity, being overweight. Now that is new. Being overweight is anybody with a BMI of more than 25. Pregnancy, chronic kidney disease, diabetes, immunosuppressive disease, or immunosuppressive treatment, just like the one I talked earlier, cardiovascular disease, sickle cell disease, neurodevelopmental disorders. And this is important, especially that we are working with individuals with developmental disability. A significant number of those with developmental disability or intellectual disability have neurodevelopmental disorders such as cerebral palsy, and any kind of brain disorders that, genetically or any other kind of issues that they may have. So neurodevelopmental disorders are very, very common in those with intellectual disabilities. And those with neurodevelopmental disorders are considered extremely high risk for COVID, and have a poor outcome from COVID when they do receive them. So those individuals who are unvaccinated and have a neurodevelopmental disorder, or vaccinated and have a neurodevelopmental disorder and have COVID, should definitely get the monoclonal antibody infusion. So what is this monoclonal antibody infusion? It is actually antibodies that are produced in the lab. They mimic the immune response or the antibodies our bodies produce in response to the virus, in response to the SARS-CoV virus or the COVID virus. So it is lab produced. So when you get that infusion into your body within the first week, even though this website says 10 days, anytime within 10 days, my recommendation is before day 5 or 7. The earlier you get it, the better the response. Because what does this antibody do? Once it goes into the body, it stops the multiplication of the virus and thereby decreases the viral load and thereby produces this less severe illness and decreases the risk of that individual needing hospitalization or ventilation or even death. So given early, it is extremely protective because it can go and fight the COVID virus or the SARS-CoV virus if given within 5 days or 7 days. So the earlier you give it, the better the outcome. So who should receive it? Individuals who are unvaccinated and have these high risk conditions that I talked to about, and have COVID or have been exposed to COVID, or vaccinated individuals who have the high risk situation, the high risk category I talked to you about, and have COVID. So unvaccinated, high risk, whether you have COVID or exposed, vaccinated, who have COVID and have the high risk. All right. So these are the two groups of individuals you can, the two situations where you will need the infusion. How can you get the infusion? There are the Department of Health and Senior Services on their website have published infusion centers, the sites of the infusion centers that are available for use. Typically, even the local hospitals are doing it. So if you live in a county, a local county hospital should be able to do the infusion. You can get it in any way, but these are some of the centers that the government has set up specifically for monoclonal antibody infusion. But you can get it at your local hospital. You can talk to your doctor and ask for it. If the individual that you're caring for, or you or anybody you know is vaccinated or unvaccinated, has COVID and has one of these high risk conditions that I called out earlier, call your doctor and get the infusion. Getting the infusion before day 7 will definitely make room for a better outcome. It is not useful after the individual has needed oxygen or has become sick. So if it is going to be useful, it has to be given early before the person gets really sick. So get it done early. Let me answer some questions. Kaika, can you read some of the questions?
I can. Let's see here. One of the questions is there any information about vaccinations for children under 12 being available?
At this time, it is still in the developmental phase, so we have to wait for it. So once we have FDA approval for emergency authorization, then we can move forward. But at this point, it is still in the trial phases.
Okay, and I believe I have a couple questions sent privately, which I'll share with folks. And then the only other question I believe is for Wendy. So I think we're good on questions.
I have one that has come up privately to me. Did the guidance change regarding the third dose? At one point, it was said it should be 6 or 8 months after their second dose. I heard you say 28 days. No, the guidance has not changed. So right now, it is only open for those with immunocompromised. The third dose is only open for immunocompromised individuals. For other individuals, we're waiting for guidance from the FDA and CDC, which you should have within the next week or two, and most likely that will not start until 20th of September or later. So in order to get the third dose, you can get it anywhere between 6 or 8 months of your last dose, but you should have at least had 28 days between your second and third dose. Does that make sense? So if you're going to get it, for immunocompromised individuals, you should wait at least 28 days before your second dose and the third dose. And most people are probably much further than that, between a month between the second dose, and if they immunocompromised and they need the third dose, they can get it. But as long as there's a month has passed between the second and third dose. The other question is, what about for the regular folks who are waiting for their third dose? They should wait for at least 6 to 8 months after their second dose. So these are two different scenarios that are mixed in the question, and I hope I made it clear. And if you have any more questions, feel free to drop in. And I have one more. Give me one more minute. Is the monoclonal antibody infusion the same as the BAM infusion? So when we had the other virus, the original virus, and then even the alpha virus, the BAM, I forget the full name, the particular BAM, that's another name of a monoclonal antibody as well. That was approved for the SARS-CoV-2. After the Delta came along, they found that the Delta did not respond to all monoclonal antibodies. It specifically, there were 2 specific monoclonal antibodies that they found responsive to Delta. One is the Region CoV, which is available as an infusion and also as a subcutaneous form as well. So if there's undue delay in getting the infusion, you can get as a subcutaneous form as well after talking to your doctor. So that is one. And there's another monoclonal antibody. It starts with an S, and there are just these 2 that are approved for Delta. So it is the monoclonal antibody, but it's a different formulation specifically for the Delta. All right.
Okay.
Yeah, go ahead.
Dr. Stanislaus, there was a question. Someone asked about the DMH employee COVID testing policy because they're starting COVID routine testing at their place of employment. It says, we're wanting to mirror what the state is doing. Of particular interest is how often do you test employees after they've traveled? So
2 things. Currently, if we do not have too many positives in our facilities, let's say that, DMH has got 14 or 15 facilities that which are state operated, both for both psychiatric hospitals and intellectual disability HAP centers. So in these facilities, the protocol is right now that if you do not have too many staff test positive, then we just do Binax twice a week. So every employee is tested with Binax twice a week as a screening measure. And this is because we have pretty high community transmission in the communities where our facilities are located. If there are many staff who are tested positive or testing positive, then we increase the frequency. So they're allowed to decide how frequently. It may be every other day, or even continue 2 to 3 times a week. So it's depending on how many staff are testing positive. But there was a time in one of the facilities we were having 15, 20 staff test positive every week. At that point, they increased the testing to daily in that facility. So it is based on how many staff are testing positive. Based on that, they increase the frequency. But it is typically recommended at twice a week with Binax, depending on your community transmission. And in Missouri currently, the community transmission is quite high in pretty much all our counties. Exposure, if you had somebody who was exposed to a staff at work, then we do test them every other day for a period of about 10 days, unless they're symptomatic. Then we test them and we send them home. But usually that is after exposure testing is every other day for 10 days. So that is kind of our testing. We have, because we also take care of residents, and if there's exposure, it's a very complex testing protocol we have. If you want to learn more about it, get in touch with me and I'd be glad to share that. Other questions?
Okay. One other thing, someone says, so if it's over 8 months since the second dose, will folks have to start the entire series over again?
No, just the 1/3 dose. Again, this is just this criteria or guideline has not been released by FDA or CDC yet. So I don't want to put too much weight on this. I just want to wait till we get the exact guidelines. This is for the folks. Right now, the guidelines are only for immunocompromised individuals. For the rest of the population, there is talk about the third dose being made available for everyone else. And that particular criteria or guideline has not been released yet. So let's wait to get those guidelines released before we talk about it more extensively.
Okay, and one other came in regarding testing for DMH staff. Does that include support coordinators?
Anyone who comes to work in DMH, or even if you're a support coordinator and if the person is working in the community with clients, yes.
Okay, and I believe that is the last question that we have.
Thank you all. Have a nice day. And I think the station MD is next, and they should be able to they should be able to answer more of your questions related to vaccination and monoclonal antibodies as well, and probably will do a better job than I did. Thank you all. Have a nice day.
Thanks.
You're on, Doctor.
Okay. Hello. Hi, everyone. Thank you. I appreciate it. Thanks, Dr. Stanislaus. For those of you who don't know me, I am Malik Trivedi. I'm one of the physicians and partners with Station MD. And just to refresh everyone's memory, or for those who don't know, we are working with the division and department to provide our physician services to those individuals on the waiver services 24 hours a day, 7 days a week to serve as a resource. I'm going to just talk a little bit about some examples of when we have been called, real examples of when we've been called, and also to give you an idea about regarding specifically, I'll address first this monoclonal antibody issue. Dr. Stanislaus did an excellent job and kind of touch on some of the high points. I would interject a few things, and some of this is unfortunately a policy issue from a federal level. On August 18th, top U.S. officials issued a statement, which was kind of an unusual statement, saying that they plan on starting to offer the boosters on September 20th for people who are 8 months removed from the second dose of either Pfizer or Moderna. The announcement kind of came ahead of the typical FDA and CDC review process. So it's from my understanding, the FDA plans to reconvene its group of advisors on September 17th, just 3 days before the White House is planned to start rolling this out. And we should have a little more guidance on that. So we are staying on top of it. Unfortunately, as we've all experienced, that these things change, and it's kind of a moving target. We're trying to stay ahead of what's going on from a policy perspective. We want to base these decisions on science, and there's a lot of questions still that remain. But from my understanding, the guidance should come out September 17th, and we'll have a little more information. From your perspective, we are staying on top of that. If you have questions, you can always contact us. If we deem an individual needs the monoclonal antibodies, for example, we are able to assess them and provide that in terms of physician perspective and give you more information. We are working on some correspondence and that will allow you to give you a little better understanding. It is a little confusing for everyone, but just want to let you know at Station MD, we are a resource for you to answer questions regarding that. And then again, as we get and learn more about that process, we will keep you updated. I do want to kind of give you an idea and give you some real data about our services and what we have seen. And I think I'll be able to share my screen here. Can you see all that, hopefully?
Yes.
Okay, great. So these are just kind of a snapshot, a high-level view of the calls that we've received in 2021 so far. And the blue are the number of ones that we've called and avoided any ED visit or sending them out. The gray are the ones we send out that we feel that we need to get more evaluation in the emergency department or urgent care or whatnot. So obviously the highest one are medication issues. So what does that mean? So if you have a question about a medication, you need a refill, Sometimes we get calls like, oh, we opened the blister pack and a pill is missing, or someone took more than one. Anything that regarding medications that, we're happy to answer those questions. And again, it runs the gamut of potential medical scenarios that you probably are very familiar and encounter. Cellulitis, skin infection, fall, of course, contact with exposure to, and that's COVID most likely, a lot of questions about that. Quarantining, isolation. These are the various things that we get calls for. Vomiting, abdominal pain, seizures, diarrhea. So it gives you an idea of the typical cases that we see. I don't want to get too in the weeds of how we handle each case because each case is unique. But we may see someone with a cough, for example. One of the individuals may have a cough, and we will assess them, and our physician may feel that the individual's fine. It's a viral infection, nothing needs to be done. Or they may feel that, well, let's e-prescribe medications. The medications will be delivered, or you pick them up, whatever modality you have, and then we will call back and reassess the individual. The goal of this whole process is to attempt to keep individuals in their home setting whenever it is possible, but most importantly, when it is medically safe and relevant. There's a lot of these things that you really don't need to be sent out. We can also help coordinate care with the primary care physician. For those of you who have used our service and understand it, you kind of know what we do. But for those who haven't, there's always a question of when to call and when not to call. And again, not to sound like a broken record, but if you're not sure, call us and we will let you know, and we will help facilitate that question and get you to at least to the right person. Some of the other examples that we do see, for example, are abdominal pain. And not all abdominal pain obviously can be treated in place. And you can see that the gray there, those are the ones we send out. I do want to add that if we do send someone out and we feel that we can't provide those services, we will contact the urgent care emergency room in advance and let them know that you are coming. And that oftentimes will help expedite the care, hopefully eliminate some unnecessary testing, and provide that physician at the receiving facility some more guidance. The flip side of that is when you do go, there's a lot less reluctance to send someone back home to the group home or home setting because they know that we will follow up on them. So this just gives you an idea of some of the calls that we receive. And again, it's by no means an exhaustive list, but we are there to serve as a resource for you. So I think I will stop sharing and see if there's any specific questions for me. And Heike, you let me know if you see anything.
So I don't know that this is necessarily specific to what you just shared, but we did have someone ask about side effects on the third shot. If you might want to toss something here. It says, are people experiencing intense side effects from the third shot like they did on first and second?
So I will tell you, it's still relatively new. I could tell you anecdotally, what I've heard is that the same side effects that you heard about in the first shot, which is wide and varied, are the ones that people are experiencing. Obviously, pain at the injection site is number one, but outside of that, are sometimes people feel slightly malaise, weakness, low-grade fever is not uncommon. That just means the booster is working. But outside of that, I don't want to say specifics because I have not encountered tons and tons of people that have had this additional booster yet. So, my high level discussion on that would be it's probably going to be very similar. And just so you guys know, and there's some question like this, there's nothing magical about this booster. It's the same shot. It's just an additional shot with the thought process being that it will provide the body additional immunity, or if there's some waning immunity that is going on with the current antibodies that you have. I will say that from my discussions with colleagues and from what I've read is one thing I will add is this shouldn't preclude you, and especially those individuals that are immunocompromised or vulnerable, from getting the flu shot. I don't have full guidance on what this flu season is going to be like, but there's no reason you shouldn't get that. There's no reason you should curtail any other medical, continuing medical care that you or your individuals are receiving. The last thing I'll say is Missouri, like many other states, are experiencing the hospitals are experiencing, tremendous surge in volume of individuals with COVID, obviously, but because of that, other issues are being neglected and they're waiting forever. I'm sure you're hearing these stories about waiting in the ER for issues. And it's even more important now that we continue to provide medical care for individuals in their home setting and stay away from these burden hospitals whenever possible. Now, if it's absolutely necessary, obviously it will. So we can serve in that capacity in terms of addressing those issues that you would otherwise feel like I'd have to go to the ER urgent care. So.
All right, I think that's the only question we had.
Great. I appreciate it. Thank you for your time.
All right, thank you. And Emily, I believe you are up.
Hi, good morning. I'm Emily Lubering. I'm the new Director of Federal Programs Unit. This is my first week, so I've been asked to present a few things for our group. Just a reminder that there was a change in the SSA policy on the pandemic-related disaster assistance. And that was regarding the emergency message that Social Security Administration has adjusted their policy to now exclude economic impact payments, known as stimulus payments, from individual income and resource calculations. There was a blast sent out on August 30th regarding that change. And then the other reminder or comment that I had was related to the HCBS Enhanced Spend Plan. A blast went out yesterday regarding the August 13th of this year, CMS partially approved Missouri's spending plan with a request for additional information. To read a copy of that message response, you can access that on our website and through the blast, the link that is available. I think that's all I have. Do we have any questions for me?
I don't see anything, so I believe that takes us to Kim Stock.
Okay, thank you.
Good morning, everyone. Thank you. Just wanted to highlight 2 lines of effort that the division is currently collaborating with our colleagues at the University of Missouri Kansas City Institute for Human Development on. We have 2 upcoming webinars. We have looked at the vast array of resources and information that are available to individuals and have put together what we're referring to as a toolkit, which will be basically a one-page front and back document that will list links directly to resources from sources such as the Center for Disease Control and Prevention, or CDC, from the Missouri Department of Health and Senior Services, an informational document that was developed in collaboration between the DD Planning Council in Missouri and the Missouri Department of Health and Senior Services, some information through some of our Observe, Decide, Act documents within the division, and resources that have been developed from UMKC IHD. And then we're also including Station MD information and resources as well. We're hoping that this toolkit will serve to provide direct access to important information and resources to assist individuals, families, and caregivers when making those important individualized decisions right now regarding COVID-19 and the public health emergency. We have one webinar that we will be co-presenting with our colleagues at UMKC IHD. An email blast, I believe, went out earlier this week on that and is available on our website if you're interested in that information. That particular webinar is scheduled for September 9th from 9 a.m. to 10 a.m. And the targeted audience for that webinar is our DMHCD contracted support coordinators, our state support coordinators within the division, their supervisors, and the division's TCM TAC team members, and any other stakeholders who are interested in joining please register and do so. What we'll be highlighting in that webinar is the toolkit information and asking the support coordinators to share this information with the individuals that are on their respective caseloads as part of their support monitoring. And so it's really important for, again, those targeted audience participants to register and participate in on the webinar. The second webinar line of effort is very similar, but it's a different targeted audience. And that webinar is scheduled for September 16th. And I believe we are still in the process of preparing, and we'll be sending out the email blast on that particular webinar. And it is scheduled again on September 16th from 12:30 to 1. And the targeted audience for that particular webinar is going to be directed towards individuals who are receiving services, as well as their family members, caregivers, decision makers, any other team members, and it's open to anyone that might be interested in participating. And the emphasis and focus on that particular webinar is, again, we'll be walking through the toolkit and covering some of those links of information that has been specifically developed for individuals with intellectual developmental disabilities to assist, again, with them in making those important individualized decisions right now. And so stay tuned, and we hope that everyone is able to participate in those webinars. We will be recording those and posting them on the website as well. So I appreciate your time today. And with that, I'm going to turn over to Wendy Ritzig. I believe she has a few updates as well.
Thank you, Kim. I'm going to start off by answering one of the questions that was in the chat about if StationMD is available as a waivered service. So it has been approved by CMS through our Schedule K, but we are still awaiting on final approval with MMAC and MoHealthNet division. So as soon as the system is ready to accept authorizations for StationMD as a waivered service, the division will distribute a memo describing the enrollment process. So currently all persons that are enrolled in the waiver should continue to access StationMD, and you can access it through the normal course of action of how you've been able to do it up till now. The waiver authorization only changes the funding stream, not the availability or access to the service. So continue to use StationMD, and if you're not signed up, certainly go ahead and get signed up the way you've been used to. Your support coordinator will be able to help you with that. And then the only other thing, unless there's something in chat, I will let people take a minute to look at that, is that I wanted to introduce to the group virtually, and I'm not sure if Amber is able to be on the call this morning. Amber, if you were on the call, would you please turn your camera on so people can see you? And like I said, I'm not sure that she was able to join us, but I wanted to introduce and let you know that we have filled the Assistant Division Director position that was previously filled by Marcy Volner. It is Amber Doherty is the new Assistant Division Director for the Central Region. And so that covers the Kirksville, Columbia, Rolla, Sykeston, Poplar Bluff, Cape Girardeau areas, kind of down the middle of the state from top to bottom there. And Amber has worked for the department for a number of years. She started as the assistant to the general counsel's office for DMH, and after 2 years moved on to be the director over investigations for the department and was there for nearly 4 years. So prior to working for the division and the department, she served as the administrative hearings officer for the Department of Social Services. And I'm just really excited to have Amber on board. I've had the opportunity to work with her in her 2 different capacities within the division. She brings a wealth of knowledge and expertise and is eager to learn the specifics about the division and how we do business on this side, but has just got a stellar reputation of working well with her team, team development, performance improvement, and so she's ready to be on board. She started on September 1st. So please welcome me. If you are in any of those regions, feel free to reach out to her with questions or to welcome her on board. Her email is like any other state email. It's her first name dot last name amber@dmh.mo.gov. So it's AMBERD.DAUGHERTY@dmh.mo.gov. So please drop her a note and welcome her on board. We're excited to have her. And are there any questions that have come up in the chat, Heike, for any of us on the panel?
There has not. Well, no questions for the panel. There was one question about the transcript and when that'll be posted. So for the rest of you, the recording and transcript will be available on the website next week. And
All right.
I believe that's a wrap. So I would like for everyone to have a wonderful and safe holiday weekend and enjoy every moment of it. Thank you.
Thank you.